And here is your question.
Ma'am,
Yes.
hello.
Yes.
I'm
Just
sorry.
5. Yes.
I'm sorry to interrupt. Is this polycystic kidney station, ma'am?
Yeah.
Okay.
Okay. So if you have read and understood, considering it surgical pathology station, please tell me the pathophysiology of the condition being discussed.
The the pathophysiology, probably it could be polycystic kidney of disease, ma'am.
Yes, but how it takes place?
It happens due to repeated cell divisions of the renal tubules,
Okay.
and which results in outpouching or outpocketing of the renal tubules, and a collection of fluid inside the pockets, and which results in saccular cyst formation,
Okay.
and gradually and gradually the cyst enlarges in size, and it undergoes mural epithelial proliferation, and due to increased trans epithelial secretion, the fluid inside the cyst gets accumulated more and more, and it gets isolated from the parent tubule. So eventually, it results in formation of a single cyst.
All right. Good. Uh. Okay. Can you tell me it develops from which layer of epithelium? Told you.
It starts from the cortex, ma'am,
Okay, from
outer layer.
cortex to mural. Yes. All right. Can you tell me how this condition occurs?
It could be in due to inheritance, ma'am. Hereditary. Probably
Hereditary, yes. But is
autosomal
it
dominant.
autosomal dominant or autosomal recessive? This is I want you to tell me. What are the
Ma'am,
genes? Yes.
both, but polycystic kidney disease 1 and 2. One
Yes.
is more and occurs at
It's
a younger
autosomal.
age,
It's
whereas
autosomal dominant.
two
It's
is,
not. Yes, I'm sorry, but it's autosomal dominant.
yes, ma'am,
It's
it
not.
is autosomal dominant. Yes,
Yes,
ma'am, it is autosomal dominant.
you said both, so that was wrong. Anyway,
Okay.
yes. Tell me what are the difference of autosomal polycystic kidney disease of adult and polycystic kidney disease of a child?
Mm.
Pathological difference between these two.
Sorry, ma'am, I'm not aware of it.
Okay, this polycystic kidney disease can also be associated with other pathologies. Can you mention few?
Yes, ma'am. It could be associated with liver cyst, pancreatic cyst, splenic cyst, and it could be associated with Berry's aneurysm
Yes,
in the brain.
and mitral valve prolapse.
Mitral valve prolapse, yes, ma'am.
These patients, in case of, because we are dealing with the adult polycystic kidney disease, they present with what type of symptoms?
So they have symptoms. They'll have abdominal pain.
Yes,
They would
other
have
than pain.
hematuria. They would have hypertension. They would have irregular mass in the abdomen,
Yes,
and frequent infections, urinary tract
yes,
infections, and
hypertension.
hypertension. Yes, ma'am.
All right. Okay. You told me. Right. How would you, what are the differential diagnoses that you'll consider for this patient?
I would consider differentials would be a simple cyst or acquired polycystic kidney disease,
Yes.
cystic disease,
Yes.
tubular sclerosis,
Yes.
one Hippel-Lindau syndrome,
Yes. Though it's
and yes, ma'am, and medullary sponge kidney.
all right. Okay. What are the complications that this patient can present with that you can already predict?
They eventually they will land up they will land up in having renal failure
Yes.
in the later stage. The complications will be pyelonephritis. They could form renal calcium,
All right. So
and
what?
because
Yes.
of the enlarged cystic size, they would go for vascular stenosis and interstitial fibrosis, ma'am.
All right. Good. So what management can be offered to these type of patients?
Management to control the hypertension,
All
we
right.
can give them 12 pan, and to I would consider him having low salt diet,
Okay. And
and if he lands up in a renal failure,
yes.
I would suggest for a transplant, nephrectomy, if necessary, transplant.
All right. So what type of matching for the renal transplant you would consider?
I would go HLA
And
and
ABO.
yes, ma'am, ABO.
All right. When it comes to HLA matching, tell me which one are
HLA-DR
yes
is
is
more accurate, ma'am.
more
HLA-DR.
informative. Okay. While considering the renal transplant, what are the things you have to keep in your mind?
Regarding the complications, ma'am, or
Yes, regarding the complications or what things you have to deal with when you're thinking about the transplant, renal transplant. One could be,
complications,
yes.
initial early complications, acute, hyperacute, acute, and later
Okay, these are
uh,
the rejections that you'll think of.
rejection.
Other
Yes, ma'am.
patient would
Other,
have to
I will
take, yes.
lymphocyl. I'll consider lymphocyl,
No,
and
other is patient would have to take lifelong
yes,
immunosuppressive
life, yes,
medications.
ma'am. Yes, there's some lifelong immunosuppressants and steroids.
Yes, so
Mhm.
those complications which will be like given as a gift in addition to save the life because of the immunosuppression. Can you mention few?
Um,
Malignancy,
malignancy.
life. All right. What are the most common malignancies that can occur because of the patient has to take the immunosuppressive medications?
And endometrial carcinomas, ma'am.
No, think squamous cell carcinoma of skin.
Squamous cell carcinomas,
What
yes, ma'am.
other lymphomas?
Lymphomas, yes, ma'am.
Cap Kaposi carcinoma. What else?
Carcinoma.
Basal cell carcinoma. So these are the 4, 5 most common ones that occur as a result of these. What else can happen? If there is a
They'll be
graft
more prone
rejection, yes, what
uh,
what can happen?
for regarding the drug complications of taking immunosuppressants, ma'am.
You've already told me. I'm asking
Okay.
with the graft rejection, what would you do? What can happen with the graft rejection?
I'm depending upon if it is acute, if it is
Yes.
hyperacute or acute, I have to remove the graft.
Yes. And if it is
And if it
chronic,
is a late complication,
yes.
probably it could be because of vascular complications. So I would consider doing a stenting, a vascular stenting.
All right. Okay. Good. Yes. So, all right. In this, what would be the most gross pathology in case of adult polycystic kidney disease?
Um, a pa- um, the kidneys will be enlarged, and the kidneys would be having multiple cysts, ma'am.
Can you help me to read this image that you're looking at?
This is side of left kidney, left enlarged polycystic kidney, ma'am.
Polycystic kidneys, are they enlarged or they shrunken?
They are actually shrunken, ma'am.
Yes. So what do you see? You have to describe everything that you can see. You
Okay, ma'am.
are looking at this sample, okay? So
Mhm.
there you are looking at what? Cysts
Cyst,
of
ma'am. Cyst.
of various stages or various sizes. How would you describe it, please?
Sorry, I'm not able to hear you, ma'am.
Yes, I'm asking you, can you describe everything you are looking at? What exactly are you seeing? There's
I can.
this, okay,
Yes, ma'am. Yes,
different
ma'am.
sizes. What else can you see?
Um,
See, these are darker than others. So what's happening?
hemorrhage.
Yes. So describe everything that you see.
Okay, ma'am.
Because they can give you an image and they can ask you to describe. So you should be able to
Okay,
tell.
ma'am.
Any stain that you know of, which has been done to preserve this sample, then hemorrhages you are seeing, you can even see the necrosis or yes. So they are some are blue, some are black, and they are hemorrhages as well. So you have to tell me everything, every pathology that you see.
Okay, ma'am.
And this is just the cyst with the filled up fluid.
Fluid. Yes, ma'am.
Yes, right. And the pedicle, pelvis.
Yes, ma'am.
Yeah. All right, good. Thank you.
Thank you, ma'am.